Like I said, 63 today. 41 of those 63 over the last 8 days. And just 8 days from now, that number's going to double. I'm not a prophet. I don't see into the future. I'm just talking what I've seen as far as the progression of the death toll from Italy to Spain to now in the United States and how this thing is moving. In New York, New Jersey, Chicago, man, Louisiana, New Orleans, they under attack by this thing. It's ravaging them. It's killing them. And you know who are the primary targets here in the United States for this virus? People who look just like me. African Americans, black folk. Yep, black folk. The preliminary data over the last few days has been startling. It's been crazy to see how as the death tolls and the cases started being, the numbers compiled, how there was a stark picture being painted of the fact that somehow or another, this virus is identifying people according to ethnicity, according to whether you're black or white, or brown or white. And the reality of this virus is this virus really does not discriminate. It doesn't. It doesn't care who it attacks. So why the disparities in number? Why is it that there are so many? And I'm going to talk about the numbers real soon, shortly in South Carolina. But why is it that this virus is going after black folks? Well, it's not going after black folks. What this virus has figured out is that there are hosts whose immune system has been weakened. Their strength has been weakened because of socioeconomic conditions that they live in over time, that has allowed them to have not necessarily pre-existing conditions, which some do, and I'm going to talk about that, but also just because we ain't had a shot at living right. Urban communities, people packed on top of each other, living in poverty. You know, it's funny. I heard the New York governor, Andrew Cuomo, today say a real statement. He said this, and I quote, "It always seems that the poorest people always pay the highest price." Now with coronavirus, COVID-19, here we are, poor people of color, once again, paying the highest price. I've put it on my social media pages consistently that we got a new target on our backs as African Americans. It ain't the police this time. It's coronavirus. And it's coronavirus because we've had lack in a lot of the areas where we should have had an equal shot, a fair shot at life. So South Carolina. Okay, let's look at South Carolina. Why do I say this? Here's the numbers for our state. Like I said, I'm not going to go all over United States or overseas and all. I'm going to stay right here in South Carolina tonight. Okay. The newest figures. These are the latest figures. Okay. Of the 63 COVID-19 related deaths in South Carolina, 46% of those were black. 29 of those 63 were black. In a population where we only represent 28% of the population. 28% of the population, and we got 46% of the COVID-19 coronavirus deaths. What's wrong with that? 41%, 26 of them were white, and 13% of them is who DHEC calls unknown. Unknown. You know, and I'm going to interject an opinion into this right here, okay? When I look at the fact that, you know, we have black people represented in this DHEC figures, and we have white people represented in these DHEC figures. And then all of a sudden it says unknown, 13%. I'm going to just speculate, venture out, take my poetic license to say that 13%, those other 8 that have died out of 63, probably represent some area of people of color in some kind of way, be it Native American, Latino, Asian, maybe. I don't know. But I guarantee that it says unknown. They call these folks unknown. But just think, if we add that number, that 13% to the 46% blacks in South Carolina who have died, if we take that number out of the 63 to 37 of those deaths being people of color by adding in the unknown variable, okay, we take it from 46% to 59%. Man, black folks, we're being attacked. And we're not being out and out attacked by coronavirus. We're being attacked by this system that we live in that has allowed us not to have the same consistency of ability, should I say, ability to fight this virus off. We ain't had a fair chance. And I'm going to talk about that. In South Carolina, the black population, 28% of the total population, but we represent 46% of the coronavirus deaths. And if we add in the unknowns, 59%. That's crazy. That's crazy. We'll talk about Black Lives Matter. South Carolina's white population. 67% of the total population is white. 67%. But only 41% of the coronavirus deaths are white, compared to 46% black. Yeah, 67% white in South Carolina. And there's a much smaller, 5% less than the black percentage of those dying from coronavirus. That's right, systemic disparities. That's right, Gina, good to see you. Melinda, good to see you. Yes. Carolyn, good to see you again. George, all right. Yes. April, good to see you also. Corius, what's going on? All right. Wyatt, what's happening? All right, good to see you all. The South Carolina's white population is 39% larger than its black population, but the black population exceeds the white population in coronavirus-related deaths by 5%. That's crazy. But it's understandable when you really understand what's behind that, okay? Why does this happen? Why is it that way? Well, the first thing we got to look at are the socioeconomic conditions that we as black people live in South Carolina, one of the worst states for poverty. Let me just say it. And most of those who are impoverished in South Carolina just happen to be people of color, okay? But social economic conditions, okay, dictated. We live in communities and we live lives here in South Carolina where many of our people of color, do not have access to quality health care, okay? We don't. And if we do have access, we can't afford it. We can't afford it. What's going on, Elvin? Good to see you. Aaron, what's happening? All right. Reverend Glover, what's going on? All right. Yes, sir. Good to see you also. And if we do, we can't afford that quality health care anyway. And I know there's many of us, especially of the males, okay, and I didn't even talk about the percentage of males that this thing affects versus females. This thing is targeting males too. But a lot of times we as males, we don't, even do our regular checkups that are necessary. You talk about, it's time for your checkup, man. I'm not going. I got to pay that copay and all of that, man. I'm not going to see that doctor and carrying on, And because of that, a lot of times we wind up with with underlying health conditions that have not been diagnosed, pre-existing conditions, what they call them. And those pre-existing conditions are because of the conditions that we've lived in all of our lives, in poverty, on the low end, in communities that have not thrived, high stress, high assault, high all of these, everything else. Diabetes high, hypertension high. We run the numbers in all of those as people of colors. And guess what coronavirus said? COVID said, I see a target. That's a willing host right there. And all I got to look for is people of color. And the numbers are reflecting that that's an effective strategy for COVID-19. It's working for the virus. And it's killing us. It's crazy. Our poor housing conditions. Many of us live in no matter, yes, we call it home. But when we stop and we think about home, is it really safe? How many of our homes that we live in, especially in urban areas and inner city communities, that we live in homes that are mold ridden, or they're old and they have asbestos in them, or the communities around our neighborhoods are dilapidated and all of this, and we just happy. But these things are taking a toll on our ability to fight off infections. This is affecting us. And coronavirus is like, yep, right there. And because of that, we're being affected. Not only that, we have this sedentary lifestyle that we live. We don't want to exercise. We don't want to eat right. We don't want to do nothing right. For many in our community, it ain't nothing better than spent their whole life from a juvenile to senior citizen status with doing everything they ain't supposed to do and nothing that's supposed to do, for sure. This is killing us. It's killing us. And it's making us willing hosts for coronavirus. Not even to mention the fact that within our communities, all we have are these convenience stores. I'm going to be nice about what I say about these convenience stores when I describe. That's right, Dr. Bell, social determinants of health. I would love to just sit down once we break through this whole thing or whatever, maybe we can Zoom or something and just talk to you about that. Get this out to the community that I'm talking to, because I'm trying to reach a younger demographic. No disrespect to the older folks on here, but I'm trying to reach our young folks, because if we don't begin to bring them along their consciousness, not that woke foolishness, okay, but real conscious understanding of the pitfalls that have been set before us that's going to prohibit us from moving forward and make us susceptible to these kind of viruses, till our young people understand it, we don't have a future. And I'm here to preserve the future by building up the present. And the present is a younger generation. Pastor, what's going on? Yeah, back to green. Full of mold, for sure. But we have these convenience stores, I'm going to call them. If I say what I was brought up calling them, then folks would have a problem. So I'm not going to use that terminology. It's another urban euphemism, but I'm going to leave that alone. But these convenience stores are no substitute for a full-service supermarket with fresh vegetables and fresh fruits there, with nice clean stores and aisles and shelves and the ability to walk up into, and it's a mental part of that too, to be able to go into a store in your community and proudly shop because the store is a nice store, but really to be able to purchase these fresh fruits and vegetables and things, and to be able to understand the value of nutritious eating, not only understand it, but be able to go buy them at a reasonable price, not an inflated price. And right now in our communities, all we have are these small convenience stores with high sodium products. Many of them are out of date and should have been thrown away a long time ago. Beer and wine and cigarettes are the main commodity that they sell in the stores, and all the rest is just a side note. Another aspect is that when you walk in right at eye level, you take your kids in because they sell candy and stuff like that. No fresh fruits, no fresh vegetables, none whatsoever. Like I said, high sodium content products. And when the kids walk in and they look, all they see is pornography right at their eye level. This is taking a toll on us shopping, and we every month we get the monthly check or whatever we get the check. Where do we go to shop at? Because many times we don't have the ability to drive to an actual grocery store or to pay the price of a taxi to get there. And have you ever, I come out of Chicago, and we got bus systems, but I know it's heck trying to catch a bus and go grocery shopping, especially when you got once a month money. Come on, somebody. When you got once a month money, we don't budget that money out too much. So by the time it hit, we ready to go spend it and go buy it. We go fill up the refrigerator and everything. And then a week later, we got trouble. I'm just telling you what I know. I ain't trying to sugarcoat this thing or not. I come from the hood, There are those who try to discount me. Well, that's Pastor Dixon or whatever, he be with them people or he with the, the suit and tie people, whatever. Yeah, I'm low end for life, baby. For sure. Food deserts. So all of those things, lack of quality health care, denial that we need to go and see a doctor, resulting in pre-existing conditions. All of these things weaken us. Our housing conditions weakening us. Our sedentary lifestyles because we won't exercise. We call exercise going up and down the stairs in the house, from the bedroom to the kitchen. That's it. And food deserts, not even being able to have access. So as this is weakening, when I'm going to say this food desert thing, when this is weakening our system to the point where coronavirus can have its way and attack us as it wants to, guess who is culpable in that in North Charleston? The same mayor who had an opportunity since 2007, 13 years to build a full service grocery store on the south end of North Charleston and just has refused to do so. And I'm going to say refuse to do so. I don't care what kind of excuses he give. Refuse to. And because of that, people's immune systems are compromised, and this coronavirus is looking for those same people. Beep, 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 beep. Got one. For sure. But I can't put all the blame there now. Now, I know some black folks on here, okay, but y'all don't get mad when I say what I got to say, okay, for sure. If you ain't want to hear the truth, you're on the wrong station, okay? You need to tune to another station, them lying people or something, but I'm not going to lie about it. I don't know why it is that black folk think that they're immune for this thing. I'm going to just put it out there. I've been to Walmart, okay? I try to go and just maybe shop at one time, make sure I'm wearing my mask and that I'm staying away from people. But man, in these stores, man, and I hate to say it, but it's predominantly people of color, predominantly, that have no respect for what's going on with this virus. Most of the folks in these stores, they're all bunched up on people. They got a little line to get in Walmart. Them people, I refused to go in there the other day because the people was all in the line like back to back. They wasn't even spaced out. Nobody had on any masks or anything. What is the problem? I saw a video of two young African Americans, a male and a female, and they were like, man, shoot, we ain't getting ready, man. We YOLO. You only live once. YOLO. We gonna do what we gonna do, man. That Rona don't want us. Lies you tell. That Rona is waiting on them. For sure. Yeah. Everywhere. I don't understand it that we just refuse to comprehend that this virus is even more deadly, and we're even more susceptible to this virus than others are. And we just acting like it's business as usual. Mad because the club ain't open. Come on now. This is crazy. So we can't just blame all of this on our socioeconomic conditions. A lot of it we can blame on just plain old stupidity. When somebody tell you that you can get sick off of something, it's better to believe it first and find out that it's a lie than to not believe it and die. Somebody write that down. For sure. It doesn't make any sense. It doesn't make any sense. Folks out here, and I'm not even going to talk about the churches. I saw Chrysalin had mentioned it earlier, and so did William Hamilton mentioned it earlier about the churches here that are having their people coming in to to service. It's crazy. I'm glad to see that North Charleston's mayor ordered his people who provide security there to stand down. Don't go there. Surprise. No, because you're condoning that if you go there, for sure. That's crazy, And of course, this is one of those places where, and I don't have no problem saying it, this is one of those pastors that will tell you, because you don't come to the service, then you don't have enough faith. And if you die, then you didn't have enough faith to live. I'm going to just put it out there straight up because I know him, But, he couldn't have anybody in church if they didn't believe the science, if they didn't believe the dead and dying that I'm talking about tonight. And what I'm talking about tonight is verifiable. It's totally verifiable. People are dying, and more people, 12 people yesterday. Remember, it started with 1. Then we had reports of 2 here or 1 there. And then one day it jumped up to 3. Then the other day it was like 4. A couple of days ago it was like 4. And yesterday was 12. Watch the numbers jump up. If you think I'm playing, I ain't playing. I'm dead serious. So when it comes to this coronavirus, okay, let me just tell you about something, okay? Now, I'm going to make sure that I did remember this, okay? How deadly is it? New Orleans had a case, okay? A case where an 86-year-old woman and 3 of her middle-aged sons all died last week within 10 days of each other, between March 20th and March 30th. She died and 3 of her middle-aged sons died. She was 86. One son was 71, another son was 58, and the other was 61. Half of their family just wiped out. Wiped out because of coronavirus. This wasn't because of complications due to coronavirus. This wasn't, any a family that just said, okay, it's that time for us to cut down our numbers or something like that. So get rid of them. No. They were planning on summer vacation still, even at that age, I'm sure. Family reunions and stuff like that. But now they got 4 empty chairs because of coronavirus. Black folks. I'm talking about black folks. See? Black folks. See them? Yeah. A prime target for coronavirus. Prime. It makes no sense. In Louisiana, and this is a fact, 7.5% of Louisiana's fatalities were black, even though they make up 1/3 of the population. 70.5% of the fatalities in Louisiana were black, even though they only make up 1/3 of the population. Okay. It's crazy. It's crazy, but it's real. It's real.